the smallest bone that is stapes, longest bone that is femur, right? Previously, we have seen Madelung's deformity because of improper growth of the radius, distal end of the radius, as a displacement and prominency of the ulna, and that is a Madelung's deformity, right? And previously, we have seen Cooley's fracture. The other name of Cooley's fracture is Dinner-Fogg deformity, in which the fracture occurs at a radius when the hand is pronated, while in Smith fracture, the fracture occurs at the distal end of the radius, but when the hand is supinated. Then we have to understand regarding Walkman's ischemic contracture, right? It occurs because of occlusion of the brachial artery. That is the Walkman's ischemic contracture.
वॉकमैन इस्चेमिक कॉन्ट्रैक्चर कंपार्टमेंट सिंड्रोम की वजह से भी हो सकता है.
Compartment syndrome. You see, ischemic contracture है. So over here, na,
क्रश फ्रैक्चर या
sorry,
क्रश फ्रैक्चर या कंपार्टमेंट सिंड्रोम.
compartment
अगर
syndrome की वजह से
कंपार्टमेंट
भी हो
सिंड्रोम
सकता
अगर कंपार्टमेंट सिंड्रोम को ट्रीट ना किया जाए तो वो वॉकमैन इस्चेमिक कॉन्ट्रैक्चर में डेवलप हो जाएगा.
हो सकता है. हाँ हाँ, करेक्ट करेक्ट. अगर कंपार्टमेंट सिंड्रोम को नहीं किया ट्रीट तो हाँ, देयर आर चांसेस कि देयर विल बी ऑक्लूजन ऑफ द ब्रेकियल आर्टरी रिजल्टिंग इनटू वॉकमैन्स इस्चेमिक कॉन्ट्रैक्चर. ठीक है. उसके पहले हमने सीखा ये ड्यूप्यूट्राइन्स कॉन्ट्रैक्चर बिकॉज ऑफ इन्फ्लेमेशन ऑफ पाल्मर एपोन्यूरोसिस, राइट? सो आर यू रेडी गाइस टू सॉल्व फ्यू एमसीक्यूज? ओके, we will take this axilla next time. Okay, you see. Okay, let's try to you try to answer this.
मस्कुलोस्पाइरल नर्व.
Musculospinal nerve.
Saturday night class.
Musculospinal nerve.
So laborers nerve, that is another name of the ulnar nerve.
मीडियन
Median nerve, yes.
Medial
Musician nerve,
ulnar
that is
nerve,
of a
medial nerve.
ulnar nerve.
अल्नर नर्व.
And musculospiral nerve, that is another name of the radial nerve.
Radial nerve.
Okay, okay. We move further. Which of the following deformity is related to dislocation of inferior radio-ulnar joint?
Madelung's deformity.
So answer is
मेडलंग्स डिफॉर्मिटी.
correct. Distal end of the radius, that is the site where there is an inferior radio-ulnar joint. So the deformity that is occurring, that is a Madelung's deformity. Because of improper growth of the distal end of radius, there is a displacement of the ulna from its original site, resulting into prominency of the lower end of ulna, and we call it as a Madelung's deformity. Now you try to answer this.
Extension at metacarpophalangeal joints and flexion at intercarpophalangeal joints.
A is wrong, B C सही है क्योंकि लोअर में होता
BC
है
सही है.
लोअर में होता है इसमें
Lower trunk होना चाहिए.
Okay, okay. So see, the correct answer is B. B and C, both are correct. You see, there is extension at metacarpophalangeal joint. What it means, flexion is lost. So flexion is lost, so automatically there is extension at metacarpophalangeal joint. Okay, so the correct answer is B, option B and C. Okay. Now try to understand this. Try to answer this.
A आंसर है इसका.
Anyone? Any other?
जब B से गलत.
B.
Okay. Okay.
The C.
Okay. C3 and D1.
C3.
Okay. You see in this na option A as well as C both are correct. You see for Smith fracture, right? Smith fracture, that is fracture of lower end of radius. What is Bennett's fracture? That is okay. Next,
Fracture of
First
the
metacarpal. First
metacarpal. That
metacarpal.
is not in
आंसर
the
इज सी.
option.
करेक्ट आंसर इज सी. बेनेट फ्रैक्चर में क्या था? बेस ऑफ फर्स्ट मेटाकार्पल बोन,
Metacarpal.
है ना? तो वो तो
अच्छा
ऑप्शन में ही नहीं है.
यस सर
ठीक है. सी दैट इज
Surgical
सर्जिकल,
neck
that is
fracture of
fracture
Fracture
of
of
the
humerus.
humerus. And lastly, you see dinner fork deformity, that is again fracture of lower end of radius.
fracture of lower end of radius.
So Smith fracture and dinner fork deformity, right? Those both are related to lower end of the radius. So correct answer is option C, C3 and D1.
वन एंड टू करेक्ट है सर
Dr. Archana says
One
1
and
and 2.
1 and 2.
Sir,
You
1,
see in
2.
Yes, तीनों बिल्डिंग फर्स्ट भी सही है और टू भी सही है.
Option A.
तो क्या प्रॉब्लम है? It should be above
90 डिग्री होना चाहिए.
About
Impinging
90.
of the hand cannot be raised over 90 degree.
correct.
Option 1.
Okay. See, it was very easy because of you see surgical neck, that is related to humerus. So from this MCQ, you will be getting on another information. Bunty's disease, that is related to spleen, right? Pullis fracture, that is because of radius. And you see wrist drop, that is because of nerve injury, right? Which nerve?
Radial now.
Radial nerve. Correct. Okay. Now answer this.
थर्ड रॉन्ग है
गलत
क्योंकि
4 और 5 गलत है
नहीं थर्ड तो सही है मीडियम
तो बी
इनकरेक्ट
इनकरेक्ट
बी आंसर है सेकंड भी
B
Okay.
होगा सर. 4 and 5 incorrect है.
Correct. You see, stapes is the smallest bone, correct. Femur is the longest bone, that is also correct. Compression to median nerve causes carpal tunnel syndrome, that is also correct. In median nerve injury, there is loss of action of triceps muscle. No. In which nerve injury there is loss of action of triceps muscle? Radial nerve. Radial nerve injury, that is supplying back of the forearm, right? And a Saturday night passing that occurs because of radial nerve injury, not the ulnar. Right? Elbow joint is an example of hinge joint, correct? Right? Now you answer this. Identify the incorrect match.
Option C.
Okay.
क्वेश्चन कंप्लीट नहीं है क्या सर? मतलब 4, 5, 6 के
अब शांति से सोचिए. तीन ही है, दूसरे साइड पे 3 ही है. You see, let's try to solve this. Na? Wrist drop. Wrist drop that is occurring because of radial nerve. Right? Remember, wrist drop or another that is wrist drop, or we can say Saturday night. Both occurs because of radial nerve. Right? Then you see ape thumb that was occurring because of median nerve.
Median.
Syndrome. That is also occurring because of median nerve. Right? You see, fifth one, it's claw hand as well as musician now. So answer for them both. That is ulnar now.
Ulnar.
Let's try to identify the incorrect match. You see, 1C, wrist drop, that is because of radial now, yes. 2A, ape thumb because of median now, yes. 3C, ape Saturday night, that is because of radial now. So all matches are correct. Right? Now we move to the second one. 4A means carpal tunnel syndrome because of median now, correct. You see,
Right.
5C, claw hand because of radial now, no. 5, that is claw hand
Ulnar.
because of
Ulnar.
ulnar now, right?
Ulnar.
Otherwise, you see, check every option and all are correct except this one, 5C. It should be 5B, right? So, B is the correct answer. Are you getting this? Question पता चला आपको?
Yes, sir.
Yes, sir. Yes, sir.
Yes, sir.
So you need to identify the incorrect match. And the only incorrect match, that is a 5C, and that is option B. Okay. So that's it from today's session, right? You see, those who are from our regular batch, right, are very very accurate in their answers, right? So requesting everyone to join our course, right, so that you don't get only need to solve mock tests, but you also get the clarity regarding the concepts, right? So just like our scholars, you will be able to answer in such a manner. Right? So do join our course, and that is very at a low cost, right? 999. So you can join it, right? And clear your concept regarding anatomy. Right? So I hope you all are very clear with the topic that have been done today, right? I would request to share your feedback, right? Those who are from our regular batches also in our group, as well as those who are newly joined. Also, I would like to share your feedback. Okay. Thank you from my side. That's it.
Sir, एक question है sir.
Thank you, sir.
Yes.
हाँ. So, which muscle is responsible for the initiation of abduction? Is it deltoid or supraspinatus?
Sorry.
Which muscle is responsible for initiation of abduction?
Initiation of abduction.
Yes.
It is
It's
supraspinatus.
supraspinatus. Okay, sir.
It is supraspinatus.
Thank you, sir.
Okay.
Thank you, sir.
Okay.
Thank you, sir.
Answer the answer.